Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore medical topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today, we explore a topic that profoundly affects the stability and happiness of families around the world: addictions. An addiction is the uncontrolled use of a substance or engagement in a behavior despite repeated harmful consequences, such as divorce. In fact, worldwide, about 7% of children live in single-parent families, and in the U.S., a stunning 23% do so. Besides divorce, family addictions can lead to shame, emotional neglect, and verbal aggression. About 1 in 8 children live in a home where at least one parent has a substance use disorder to alcohol or illicit drugs. Addictive behaviors can also destroy family life, as 56% of divorce cases involve at least one spouse with an obsessive interest in pornographic websites. Internet, social media, and screen addictions are reducing communication between family members, while gambling and shopping addictions, as well as workaholism, weaken family bonds. Thankfully, there's light at the end of the tunnel of addiction so that your family can become all God intends it to be. Joining us today is Dr. Cynthia Hunt, a board-certified psychiatrist and internist with 35 years of experience, who chairs the National Catholic Medical Association Addictions Task Force. And she's a consultant for the U.S. Department of Health and Human Services regarding addictions and mental health. Cindy, welcome to Vital Signs.
Thank you, Tom. It's a privilege to be here.
You know, as we've just heard and are sadly aware, addictions in families can seriously and tragically impact family life. So what are some of the common substance use addictions affecting families, and how did the COVID pandemic affect that?
The situation is unfortunately tragic, as you can imagine. One of the components is ongoing alcohol use. Alcohol still is the number one abused substance in the United States. And the effects of alcohol are devastating for those families who are dealing with one or more persons. When the pandemic hit, alcohol sales shot through the roof. And even those who normally didn't drink alcohol started to drink alcohol. It doesn't mean they all became addicted, but it became a substance use problem. And those who are already addicted continued. Now, other substances that do continue to be abused and are deadly, alcohol can be deadly as well, are the opioids. I just learned and read that the number of opioid deaths between September of 2019 and September of 2020 is in the 80,000 range, 84,000. That is more than any other year since the opioid crisis started. So it's tragic. There are various possibilities as to why, which we might talk about. But anyway, so families with substances, primarily alcohol, also opioids, and my prayers go out to all families who are not only affected by this, but have lost loved ones through these addictions. The other types of substances that are commonly used, marijuana is way up there. It is the most common illegal drug to be used. And I say illegal because federally it's still illegal, even though some states consider it legal. And we know that it's not benign. So marijuana is up there. And then meth is rising. Methamphetamine use is rising. And that is actually causing overdose deaths as well, because meth in itself can cause death, but also the combinations of drugs are being used more often.
What percent of families do you think are dealing with an addiction like this, and how often do you see them in your practice?
At least 1 in 5 families, the statistics show, are dealing with an addiction such as this. And frequently it's more than one in the family. I suspect that if we counted all addictions, it's even more than 1 in 5 families.
And how often do you see it in your practice?
I see it very often. I would say that the majority of patients in my practice, and my practice is a consultation practice at this point. I work with primary care doctors who need to receive some consultation for their patients in need. So the volume of my practice is huge. Having said that, definitely over 50%, 60% of patients I see who are referred for serious depression, anxiety, suicidality have also co-occurring addiction.
Oh my. So some people are addicted to processes instead of substances that you've laid out. So how common are these process addictions in family life? And how do they affect the life of the family?
Process addictions are becoming very common. The data is not entirely clear at this point in terms of how much they are involved in families. However, when we see in our practice, our experience is that gaming, social media addictions, gaming addictions, pornography addictions are rising rapidly. And I suspect that they're definitely more common than even the substance use addictions. And the other problem with them is that they're quieter, quote unquote, addictions. Gambling addictions have risen also, and those affect families. So the process addictions are receiving more and more attention in the psychiatric world and in the treatment and diagnoses in the psychiatric world. Gambling is in the DSM, this diagnostic manual, as an addiction, and others are coming along the way.
Cindy, so we've got addictions to substances, addictions to processes. What is common about how they all affect the brain?
At first, it was thought, or many people assumed, that the process addictions wouldn't affect the same brain areas. But more and more data is showing that that's the case. So for both process and substance use addictions, the brain is being affected significantly. There are three main parts of our brain, and I won't give you the technical names here, but the three main areas of the brain that are affected is one is the prefrontal cortex. People hear about a lot. That's the judgment and reasoning, the impulse control. Another part of our brain is the emotional piece of our brain. It's called the amygdala. And that is kind of the liking, the desiring, the emotions, the anxiety, the anger comes from that part of the brain. And then reward, which is the biggest part of the brain in terms of helping the brain to recognize pleasurable feelings, pleasurable events, is supposed to be normalized. In other words, we should take pleasure in eating. And eventually, through the mechanism and connections between those three parts of the brain, we do take pleasure in eating, and it allows us to create a habit of eating, hopefully a balanced habit of eating. When drugs become involved or addiction becomes involved, the neurochemicals become too highly stimulated, and so the normal pleasure from something is diminished. And that shows us why with addictions, the person wants to do more and more of the addiction. Sometimes they don't even eat. Sometimes they won't even take care of themselves. They lose motivation for other very important pieces of their life. The biochemicals are not in balance, and the cravings become high, and the judgment is off. It explains why some people steal to serve their habit, and they wouldn't otherwise, or there's a lot of lying that happens. The judgment is off.
And so probably is their ability to choose to do things, even if they know they're wrong, their brain has been changed so that it's hard to do that. And so how will these kind of behaviors manifest themselves so that parents could suggest or could, figure out that someone in their family might have an addiction?
So some of the behaviors would be unusual mood swings, grades falling if it's the children, missing a lot of work if it's a parent, the parent isolating more or becoming more agitated, more conflict between the parents. And this isn't always due to substances, but it can be. Unfortunately, the issue of pornography has caused divorces. with the children in some of the kids. They're isolating themselves, not participating in family life, and they're becoming very agitated if you ask them to get off of their video gaming and that sort of thing.
Well, which is a great segue. Can children 12 and under, I mean, preteens, can they really become addicted to video games or the internet? And if so, what does that do to family life?
Sadly, that is the case. I see children as young as 7, 8 who appear to be addicted to their video games. All of the elements of addiction, I shouldn't say all, but many of the elements of addiction are there. They're unable to stop. They know in their own way, they know and their parents know that it's destructive to them. And they are concentrating so much on the addiction that they're not able to participate in other very healthy, normal outside activities. They'll want the gaming instead of the outside activities. So these 8-year-olds, 7-year-olds, 8-year-olds, 9-year-olds, when the parents are trying to help them come off of their screens, there's aggression. Parents are being hit. There's yelling. There's screaming. And the children are developing depression and anxiety that literally are coming from the effect on the brain of the addiction to gaming.
And then what about if parents, one or both, have an addiction? What does that do to family life?
That can also, of course, be tragic in some ways. There is the domestic violence issues are huge, and they rose significantly during the pandemic. Children can witness not only physical domestic violence, but more verbal arguments. And substances increase the likelihood of those kinds of arguments and that kind of violence. The parents who are addicted, or if one parent is addicted, there's an imbalance in the family and the responsibilities. And I've seen too many children have to be a parent to their parent in these kinds of situations, and they worry about the parent. The parent might be depressed and not willing or able to seek help because maybe of their shame, a sense of hopelessness. So there are a lot of dynamics that can be affected when parents are addicted. And one of the worst scenarios can be removal of the children from the home.
You mentioned shame and hopelessness. It's a downward spiral common to addictions. Can you tell us more about how that manifests in a family and how it really reduces their desire to get help?
Yes, it is very common in addictions. It becomes a vicious cycle. As I spoke about with the different centers in our brain, the judgment area is affected. So a person who knows they might need help, their judgment is not to reach out. So part of it's the judgment issue. The other is the shame. What will other people think of me? How can I do this? I've tried so much to stop. I should be stronger. My faith should be stronger. There's a lot of ways that families and members of families do not want to seek help. One of the fortunate things is a lot of the primary care physicians now, I would say the majority, do screenings on just regular visits. So if somebody comes in for an office visit honestly for an earache, they will get a screening to be sure that they're not depressed, anxious, and in certain cases, even the substance abuse screening. So that's helping us. And in the privacy of the relationship between doctor and patient, the patient may start to feel more comfortable reaching out.
Earlier, you were talking about, even preteens fighting with their parents in anger when they have to come off a video game. So it brings up a topic that I know is near and dear to your heart. That is tough love. What does that mean, and what does it look like in families dealing with addictions?
So tough love is a varied concept, and honestly, it's unique to each family. I have to say that first of all. It's unique to each situation and to each family. However, some general guidelines are that natural consequences may become necessary in many cases of addiction. And those can range from financial natural consequences to the living environment. Now, I don't say that immediately a teen or even another family member has to be quote unquote kicked out of the house. I don't say that at all. But there can also be kind of incentives to say, okay, let's start from the beginning. Let's take baby steps. If you can at least agree to get some help, and there's documentation that you get some help, then we can provide this, this, and this. But tough love in and of itself does become necessary. It doesn't always equal the extremes that we do see sometimes, but sometimes after everything else has been exhausted, that is what helps. Now, I've talked to many adults who say that if their parents, and this would be as an adult, that they've been dealing with this addiction, and their parents who had let them live in their home as an adult, when they finally said no more, that was when that adult, young adult, was able to realize that he or she needed the help and wanted the help, because in retrospect, there was some enabling going on. Now, parents, I'm a parent, you're a parent, Tom. I get it. I get it. You want the best for your child. You don't want them on the streets.
Right.
So that makes sense. But I have to say, from the adult point of view, from these young adults who really persisted in their addiction despite multiple attempts at various types of tough love and encouragement and interventions, sometimes the ultimate tough love is what worked. So I think with prayer and discernment and lots of good communication, that can be done and needs to be done.
And from tough love in the family, moving on to the church, what is the role of the church, sacraments, or prayer for families who are experiencing addiction? Can you just pray an addiction away?
We believe in miracles. All right, I believe in miracles. And there have been some who, through their prayer life, have been healed. Having said that, though, that is not that common. A lot of times our Lord wants us to go through the trial and seek the help we need, and he utilizes physicians and other mental health professionals and the family to guide. So given that, the pastors can be very important, the community, the church community itself. There are a lot of biblical-based programs, Christian 12 steps. There's Celebrate Recovery, which is widely known and available. The 12-step program can be very helpful for many people, and it is even online now. So, but looking for a Christian-based one might be particularly helpful. Now, the sacraments, of course, if a person who is addicted can frequent the sacraments, especially the sacrament of reconciliation and Eucharist, and even sometimes it could be appropriate, I'm not going to speak theologically, but it might be appropriate for the sacrament of the sick for someone who is deep in their illness of addiction. So very, very important. And the church is recognizing this. The USCCB is recognizing this and trying to do quite a bit. In our task force, we are joining with other dioceses who are doing this work and trying to make help available and help create forums of assistance to people.
If somebody viewing has a family member or they themselves an addiction, what's the first thing you recommend they do?
Now, I have to say, always call 911 if it's a huge emergency, of course. There's violence, anything like that. And surprisingly, some don't. So I really want to encourage that occur. A lot of times the patient will be taken to the emergency room. They don't automatically get arrested. So anyway, so that's up there. The first thing they should do is talk. I think communication within the family, one-on-one or even family meetings, to just put it on the table and say, what can we do to help you? To the person who's addicted. What can we do to help you get help? We're not ashamed of you. We're not. We know that a lot of what's happening here is an illness. It's very genetic. We don't think badly of you, but you need some help because of multiple circumstances, and we're worried. So communication, number one, and then reaching out to primary care physicians, is the easiest, but also there's hotlines. SAMHSA has a hotline both for substance use, mental health use, mental health issues, and then the counties. But again, a lot of the doctor's office will have referrals for that family.
Cindy, this has been incredibly helpful. There's so many addictions that it can affect family life. Thanks for opening our eyes to them, especially the process addictions, and giving us hope for treating these in family life.
You're welcome. And my prayers go out to all families who are affected this way.
And thank you, viewers, for watching this episode of Vital Signs, your prescription for a healthy family. Brought to you by Shalom World TV and the Catholic Medical Association, where we are inspiring physicians to imitate Jesus Christ. Please join us for our next episode and share the good news of Vital Signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
You can't always.
This is the death.
Remarkably empty.
Turn back towards God. Rise up.